Starting in the name of Allah, the most precious and the most merciful. My name is Dr. Bilal and I'm Assistant Professor in Forensic Medicine Department. Today we are going to discuss the next section of the journal Toxicology, which I named as Journal Toxicology 2. Today our learning objectives will be route of administration of the poisons, how the poisons are administered inside the body, very important. What are the route of elimination of the poisons, how the poisons got away from the body. These are similar and same to the drugs which you read in the pharma. Pharma में आप पढ़ते हैं how what are the route of administration of drug, and similarly in forensic there will be the route of administration of poison. What is the route of elimination of drug and what is the route of elimination of poison in forensic medicine? How the poison act, very important. What are the factors that affect the action of the poisons? Most of the time it come in the exams as an OSPE, as in long questions, short questions, or might be asked in the Viva. What is the fate of poison in the body? Eventually, what this poison have to be happened? आखिरकार इस poison का होना क्या है? What is the fate of this poison inside the body? So most of the time, question appear in exam. What is the fate of the poison of the inside the body? So one should not aware about this कि fate का क्या मतलब है. Fate का मतलब है कि आखिरकार इसका होना क्या है, ये क्या करेगा, ये either एक्शन करेगा, ये बॉडी में स्टोर होगा, ये एलिमिनेट होगा. So we call that fate of the poisons. We'll be discussing that, very important. And eventually the most important is what is the medico-legal aspect or legal aspect of the poisoning. So let's start. Route of administration of poison or route of administration of drug is similar like that of the pharma. ये skin के through भी हो सकता है. We know that there are different ornaments we use on the skin. Similarly, different poisons like organophosphorus that can go through the broken skins, wounds, and injuries get inside. So it might be observed through the skin or might be go inside the broken skin. सही है. Second is the oral, the most commonly used, then the inhalation, then the injectable. Injectable might be the subcutaneous, intradermal, IM, IV, intrathecal, intraperitoneal, or intra-articular. So all of them must be the injectable, and this is a specific route for the administration of the drug as well as the poisons. And all the natural orifices inside the body might be the nose, ear, anus, vagina, or urethra. This is a very important slide. Here it says that the inhalational route, the route that has been used to inhale the poison, is quite much more faster than that of the IV. So it appears most of the time in the MCQs, and the student got confused and they put the IV. No, IV is not the fastest route. Inhalational route is the fastest route for the rapid action. And after the inhalational route, the IV route is the second number. Now, what is the second topic? The second topic is route of elimination of the poison, how the poison got eliminated from the body. So, we know that it can be eliminated by the metabolite form in the urine. It might be got in the feces and the respiration. For example, whenever somebody got drunk, so a large amount of alcohol has been expired in their air through breathing. So, one should can calculate their amount. So, we can find out by the respiration and as well as route of elimination through the saliva, milk, bile, might be the sweat glands or perspiration or mucus and secretion membrane. So milk is somehow very important if some mother that has been lactating and she is feeding a baby and this mother is under the effect of the poison. So at that cases, it came to affect the infant as well. So might cause the two murder by one single action. So this is important. One should know that it is also excreted inside the milk. Now the next topic is the action of the poison, how the poison gonna act. This is very important. They are classified into different categories. It might be act according to their sites. According to the sites might be the local or might be the journal. For example, if something very corrosive like sulfuric acid, H2SO4, come in contact with the skin, it will directly locally produce the deep ulcer, bleeding and inflammation. But there are different other poisons as well which are not producing the local effect. They observe inside the body and produce a very systemic and general effect. So according to the site of location, it might be the local, it might be the general. According to their action, it might work very faster, like immediate action. Burning sensation of the phosphorus poisoning is one of the most immediate action of the poison, and delayed, it might take some time, like half hour to 15 minutes and 1 hour. After that, it will start at action. So according to the action, there might be the immediate action and delayed actions. Some are specifically in their action and some are non-specifically their action. For example, arsenic has very specifically damaged the liver. Similarly, the arsenic, the phosphorus is also highly hepatotoxic. And the mercury, that is specifically in connection with the kidney, nephrotoxic. And the non-specific are, for example, uh, vagovagal shock or neurogenic shock. Most of the time, when the H2SO4 has been used on the body, the H2SO4 will cause the fear effect inside the body, due to which neurogenic shock has been activated. So this is a very non-specific action. Nobody was expecting for it. So according to their action, that might be the specific, specifically acting on the viscera or the organ, or non-specific, that is to the fear of factor of fear. Now the next topic is, what are the different factors affecting the action of the poisons? So dose, most important, we say higher the dose, higher will be the action. But after that, there are some exceptionals as well. There are some exceptions as well. All right, we'll be discussing that. After that, we'll be discussing the form of the poison. Of course, one poison that is in the form of gas gonna act very fast. Other than that is in the liquid or in the solid form. Route of poison intake, we talked about that. Inhalation is in the top, and then the IV and the body condition. For example, if the body is of a baby or a very old age person, of very old age person, at that conditions, it will highly affect the body. Of if a body belong to a very healthy person, he is a very healthy and he is of a young age. So that condition, poison might not affect it. So the body conditions are very important factor for determining the action of the poison. Let's describe the dose. The first factor that is going to affect the action of the poison, that is the dose. We talked about this. Higher the dose, higher will be the uh, sign and symptoms. What is dose by itself? This is the amount of substance that taken at one time. That substance might be the drug, that substance might be the poison. This is important. So there are two type of doses. One is the therapeutic dose, another is the toxic dose. Therapeutic dose are those doses which are needed for the treatment, and toxic dose are those doses which produce the toxic sign and symptom inside the body. So of course, the therapeutic dose will always be lesser than toxic dose, or I can say that toxic dose will always be greater than therapeutic dose. After that, there are some other definitions like the lethal dose. Lethal dose is the minimum amount of drug which is sufficient to kill a healthy person. And what will be the minimum lethal dose? So, minimum lethal dose is the dose that required sufficiently kill 1% of experimental animals. I have discussed in the first lecture two important things that we will be doing that again. That was the LD50. What was the LD50? When among the 100% of the among the 100 people, if some dose is sufficiently killing the 50 people, they will be called as lethal dose 50. So what will be the minimum lethal dose when it kill only one person or one animal among the population of 101? So that will be called as minimum lethal dose. Like only 1% of it. Among the 100, only 1%. And lethal dose is the amount to kill 99% of the experimental animals. That will be the lethal dose. Lethal dose, and LD50 is that which required to kill 50% of the population. All right. So we describe the minimum lethal dose, we describe the LD50, and after that we describe the lethal dose. Lethal dose is the dose, or toxic dose is dose which is sufficiently kill the 99% of the population. All right. We talked about that higher the dose, higher will be the effect, but there are some exceptionals. The first is the idiosyncrasy. First, we need to know what is the idiosyncrasy. This is a very abnormal reaction of anything to which the body of the other people don't show the abnormal reaction. This is called idiosyncrasy. All right. For example, in some people, aspirin and iodine, cocaine, morphine, milk, egg has very abnormal physical reactions. They are specific to the people and for foods and drug as well. We call that idiosyncrasies, not the allergic reaction. There's some abnormal body reaction to anything to which that is not supposed to be having such type of higher sensitivity reaction. The allergy, what is the allergy? This is the actually hypersensitivity reaction. For example, many families are allergic to the penicillin, so at that case it's not following the specifically law of higher dose higher the concentration. Next is the tolerance. There are different drugs and different poisons that are producing the tolerance and habituation, so at that time that doesn't produce the desirable effect. These are specifically for the tobacco, alcohol and opium. Synergism. Synergism is a rule or potentiation in which we are describing to two different type of drugs when they combine together having a very high cumulative effect. All right. For example, when alcohol is taken alone or barbiturates taken alone, they will have specific effects. But when they combine together, their potential effect will be very, very high. So what the statement say? 2 plus 2 is not equal to 4, but 2 plus 2 is greater than 4. This is the synergism. When they combine together, their total effect is much more higher. Cumulative effect mean like when these poisons are deposited inside the body and slowly get releasing through the body. This is the cumulative effect, which is also as an exceptions. Most of the time they are deposited inside the fat tissue or maybe inside the long bones. Now the next factor that affect the action of the poison is the form. What will be the form? It might be the physical form that is affecting. Like if anything that is in the form of gas will be absorbed much more faster than the fluid and solid. So physical state is highly describing the action of the poison. The chemical conditions, some are chemically combined with another leading to the non-toxic effect. For example, if somebody has taken the sodium hydroxide and accidentally or by any cause, and we are also having the HCl inside the stomach, so chemically they will combine together and produce non-toxic effect. This is all happening because they are chemical, because of their chemical natures. Similarly, lead carbonate when go inside the stomach, they combine with the HCl. After combining with the HCl, they produce the toxic effects. So why is this happening? This is all happening their toxic effect because of their chemical natures. Next is the mechanical combination. Like mechanically, how stronger are their concentrations? So higher the concentration, higher will be the toxic effect. It's say like one drop of concentrated H2SO4 is enough for the complete bucket of water. Route of poisoning will be inhalational and IV. Inhalational on top and IV is the secondary. Then we talk about the body condition. This is a very important factor that affects the poison action. That is the age. We talked about that. If a child who is not able to tolerate the adult dose or a person who is of very extreme ages are highly susceptible to such type of poison. A healthy person is able to tolerate the poison well enough than the weak or diseased person. Next is the sleep. If a person that is sleeping, so the metabolism rate got very low. So at that time, poison effect will decrease. Similarly, if a person that has been intoxicated, so intoxication also lead to the sleeping tendency. Whenever the sleeping tendency will be there, absorption of the poison will be delayed. Now we are talking about the safety index. What is the safety index? Safety index is the maximum therapeutic dose divided by maximum toxic dose. We talked about that. What is the maximum therapeutic dose? That dose that sufficiently recovered 99 people out of the 100 in a population, and maximum therapeutic toxic dose will be that sufficiently kill 99 people out of 100 population. There will be the maximum toxic dose. All right. So if we take the ratio of them, that will give us the safety index. Previously, in the previous lecture, we discussed the therapeutic index. What is the therapeutic index? When we discussed the 50% of the population lethal dose and 50% of the population effective dose, we call that therapeutic index. Very high important. Fate of the poison in body. Now, what will be the fate of the poison in body? There's another topic that might excrete through the body, either in the form of feces, vomiting, urine. It might metabolize completely inside the body and liver. It might produce the sign and symptoms, or it might retain inside the body. For example, arsenic has higher retaining properties inside the bone, hair, skin, and throughout the time it got might be converted into a chronic condition, or might be uh, uh, producing time by time toxicity. Now we are discussing the legal aspect of the poison. What are the legal aspect of the poison? On top, it's a criminal offense. No matter what for the poison has been used, it's a criminal offense. Second is if a person is not using for criminally and it's not intent to kill someone, but it's a recklessness to use such type of poisons in a higher concentration. All right. Whenever we use any poison or any drug to facilitate the commission of the crime, this is absolutely wrong and absolutely criminal offense in the medical legal aspect. For example, if somebody want to do the robbery or want to do the rape, and that condition they want to stupefy their victim and perform such action, so this is criminal action. When a poison is administered into another person or woman to procure abortion, and the woman and that infant also, and the woman and that we cannot call that infant like fetus died. At that condition, the person will be guilty for the manslaughter, right? Two murders will be uh, under its uh, specifically has to answer for them. So yeah, so the medical legal aspects are, first of all, it's a criminal offense and recklessness use of such persons is not allowed. To facilitate a commission of the crime is a criminal action, and the person is guilty of manslaughter if he perform an abortion and then the fetus plus the woman dies. Thank you so much. If there are any question, please do ask me. uh, I'll be making another video for the next topic of the general toxicology. Thank you so much.